Hello? Today we will talk about the deadly diseases of our time. The first disease of COVID-19. Coronavirus is a very dangerous virus that has killed and continues to kill dozens of people. People have come up with a vaccine against it, but it's not enough, and mortality is rising. Especially in the summer, this disease is gaining new opportunities. First, it affects the lungs, and then it goes further, and modern medicines cannot stop it. An infectious disease that was first detected in humans in December 2019 in Wuhan, central China. The disease began as an outbreak that developed into a pandemic. The cause of the disease was the SARS-CoV-2 coronavirus, whose circulation in the human population was unknown until December 2019. The World Health Organization, WHO, recognized the pandemic as an international health emergency and included measures to combat it in the temporary recommendations under the International Health Regulations 2005. To avoid stigmatization associated with the geographic region where the first cases occurred, as well as with race or a particular ethnic group, the WHO approved the official name Coronavirus Disease 2019, COVID-19. On May 5, 2023, the WHO announced that the 2019 coronavirus disease is now an established and ongoing public health problem that no longer constitutes a public health emergency of international concern. Our next disease is cholera. The disease is caused by a bacterium called cholera vibrio, V. cholerae. Most epidemics are clearly associated with waterborne transmission of the infectious agent, but the spread of the disease in domestic settings is also facilitated by direct contamination of food with infected feces. The contact route of transmission is also possible, for example, through contaminated hands. The incubation period between the ingestion of contaminated food or water and the onset of the first clinical symptoms in a patient ranges from several hours to 5 days, with an average of 1-2 days. The source of infection is only human. What you need to do to prevent cholera: follow the rules of personal hygiene. Use only guaranteed safe water and drinks. Do not eat food products whose quality is questionable. Avoid resting in unauthorized places. When swimming in open water, sea, rivers, ponds, try not to swallow water. Avoid contact with people showing signs of infectious intestinal diseases. Persons traveling to countries with an unfavorable cholera epidemic situation should be especially careful to comply with these rules. If a person develops gastrointestinal symptoms within 5 days of returning from such countries, they should immediately consult a family doctor. Self-medication can lead to severe complications and consequences for human health. The next dangerous disease is plague. Plague is an infectious disease caused by the bacterium Yersinia pestis. This bacterium is zoonotic, which means that it can be transmitted to humans from other animals. In the case of the Black Death, this happens through a bite from an infected flea or rodent, unprotected contact with contaminated body fluids or tissues, inhalation of respiratory droplets from a patient, or even from a sick domestic cat with the pulmonary form of plague. Diagnosis: the presence of a known flea bite and a swollen lymph node will help the doctor identify the disease and begin treatment. However, in the case of respiratory or septicemic forms, there are no such obvious signs, so the best test is bacteriological, with the subsequent isolation of Y. pestis culture from manure, blood, or sputum. Specific tests for plague antigen are also common. Rapid diagnostic tests are widely used in Africa and South America, despite the fact that today the disease is no longer as formidable as in the past. It is still a serious infection if treatment is not started in time. Currently, according to the CDC guidelines, antibacterial drugs from the fluoroquinolone group, ciprofloxacin, moxifloxacin, levofloxacin, as well as gentamicin, streptomycin, and doxycycline, are used as the first-line treatment for plague. It is noted that these drugs are effective in the treatment of any of the forms. The next insidious disease, HIV. HIV infection is a socially dangerous infectious disease that develops as a result of infection with the human immunodeficiency virus, HIV, long-term persistence of HIV in lymphocytes, macrophages, and nervous tissue cells. The disease is characterized by progressive dysfunction of the immune, nervous, lymphatic, and other systems of the body. According to modern concepts, HIV infection is an incurable disease, has a long chronic course, and, in the absence of effective therapy, ends in the patient's death. After infection, the virus begins to multiply rapidly, affecting various cells, organs, and systems of the body. After 6 to 8 weeks, 1/3 of infected people develop acute HIV infection, which occurs in the form of fever with weakness, fever, joint pain, as is often observed in acute respiratory infections, while others go unnoticed. In 1.53 months after infection, antibodies to HIV appear in the blood of an infected person, which are the basis for the diagnosis of HIV infection. The period from the time of infection to the formation of antibodies to HIV is called the seroconversion, or diagnostic window. The main lever in preventing the spread of HIV infection in the country is to maintain a healthy lifestyle, refuse to engage in HIV-risky behavior, especially drug use, and to use condoms during sexual intercourse. A conscious attitude to one's health will ensure protection. And the last disease for today is bubonic plague, is one of the clinical forms of plague, a zoonotic, naturally occurring, focal bacterial infectious disease characterized by fever, severe intoxication, hemorrhagic syndrome, serous hemorrhagic lesions of the lungs and lymphatic system with the formation of tambourines, frequent septic course, and high mortality. It is when the plague is based on the occurrence of widespread inflammation of the lymph nodes with the formation of a large infiltrate that the so-called bubonic plague, a painful conglomerate of lymph nodes in a certain part of the body, occurs, and the clinical form is called bubonic plague. Accompanied by the development of lymphadenitis, the disease begins acutely with an increase in body temperature to 39.5 to 40 degrees C, and severe localized pain at the site of the bubo formation. This pain makes movements difficult and forces the patient to limit them and take a stiff posture. The inguinal, femoral, and axillary lymph nodes are most often affected due to frequent inoculation of the pathogen into the lower and upper extremities, which are more accessible to flea bites.